Good morning and welcome to our webinar, Medicaid Long-Term Care Waiver Application Process and Waitlist. My name is Robin Coker. I'm the Director of Communications at Disability Rights Florida. I'm a white woman with blonde hair, wearing glasses and a burgundy-colored shirt. On the screen, we have a PowerPoint slide with purple background and orange and white graphics and lettering. The speaker for today's webinar is Caitlin Klibben, an attorney and Disability Rights Florida's Director of Community and Health Services. First, we will review the accessibility features of this webinar. Our webinar includes closed captions and American Sign Language. Closed captions are available at the bottom of your screen by using the button that says CC. In the chat, there is a link to view the external caption. You can click on that link and have your captions appear in a separate window on your computer. We also have two American Sign Language interpreters today. They are spotlighted on your screen and should be visible at all times. If you cannot find them, make sure your participant setting shows all video participants. If you have questions during the webinar, please submit them to the Q&A. The Q&A button is at the bottom of your screen. You can also send your questions to an email address, webinar@disabilityrightsflorida.org, and we will answer them at the end of the presentation. Lastly, this webinar will be recorded and posted on our website and YouTube channel. Now that we have the housekeeping complete, I'll pass things along to Caitlin, who will begin by providing a brief overview of Disability Rights Florida and the agenda for today's webinar.
Hi there, I'm Caitlin Klibben. I'm the director of our Community and Healthcare Services team at DRF. I'm a white woman with brown hair and glasses and a green sweater. First, I'll go through some brief information about DRF before we get to our presentation. So Disability Rights Florida is the state's protection and advocacy system. We have funding, responsibility, and authority under 9 grant programs from the federal government to protect the rights of Floridians with disabilities. We're a nonprofit, and we've been a nonprofit in Florida since 1987. And we have offices in Tallahassee, Tampa, Gainesville, and Fort Lauderdale, though we do represent individuals statewide, not just those cities. Our mission is to advocate, educate, investigate, and litigate to protect and advance the rights, dignity, equal opportunities, self-determination, and choices for all people with disabilities. So in today's webinar, we're talking about the long-term care waiver. We're going to talk about the eligibility requirements, the application or screening process, the waiver wait list, and the rescreening process for those who are on the wait list. And just a quick note here that we can't advise on specific cases today. We'll have an opportunity for general questions, but if you have specific questions about your individual case, please contact our intake department, and we'll be happy to talk with you. And the contact information for how to contact our intake department will be at the end of the presentation. So first, the eligibility criteria for the long-term care waiver. The basic criteria are, it depends on your age what the criteria is. So for those who are 65 years old or older, you must also require a nursing facility level of care. Other individuals, folks who are 18 years of age or older, you can qualify if you're 18 years of age or older if you also are eligible for Medicaid by reason of disability and you require that nursing facility level of care, or a person 18 years old or older can also qualify if they have a diagnosis of cystic fibrosis, and they require a hospital level of care. And for all 3 of those categories, you have to meet the financial eligibility requirements for Medicaid, meaning that your income and assets must be below the threshold set for Medicaid. So That's really those are the categories of people who are eligible. So I'm going to move forward to the screening process, how you apply. Um, so it's to apply, essentially you request to be screened. You have to be screened both for your financial eligibility, that the income and asset limits for Medicaid, and also for your medical eligibility, whether meet those levels of care that are required. So the financial eligibility is decided by the Department of Children and Families, and the medical eligibility is decided by the Department of Elder Affairs. The Department of Elder Affairs has the screenings done by entities that are spread across the state called ADRCs. That stands for Aging and Disability Resource Centers. So there are different ADRCs in different parts of the state. And what you do to get screened is you contact one of those ADRCs to request that screening. To begin that process, you can do it by phone, and I've included the phone number here on this slide. That's the Elder Helpline, or there's a website at the Department of Elder Affairs that will show you a map where you can select your county, and it will tell you which ADRC that you should be contacting. Okay. So once you've found your ADRC and you're ready to get screened, that screening, you've requested your screening, that screening is going to be done over the phone generally. It takes like 45 minutes or an hour. They ask you a bunch of questions, and I'll get to, kind of what they're going to be asking about in that hour on the next slide. But the purpose of the screening is to determine whether you meet those criteria, the basic eligibility criteria I described in the beginning. And it will result in you getting a priority score. So your priority score is essentially what rank you are on the waiting list. There are different categories, and I'll go through those again in a couple of slides. So once your screening is done and they have made a decision about your eligibility and what priority score you qualify for, you are supposed to receive notification of those decisions in writing. And you receive the results in writing, but you don't necessarily receive the screening itself. So if you want to see the document, the tool they use to complete the screening with the answers that you gave them to make sure they're accurate, you can also request a copy of that screening tool, and they must provide it to you if you request it. Okay. So what are they screening for? This is essentially, what are they asking you about in that hour-long phone call? So what they're looking for is information that would get at, again, your medical qualifications, your diagnoses, your age, and then your level of care. Are you requiring that nursing facility or that hospital level of care? So they're going to ask you questions about your mental health, behavioral health, cognition. They're going to ask you about your physical health, any impairments you have. They're going to ask you about your ability to complete your activities of daily living and your instrumental activities of daily living. They're going to want to know about your nutrition status. Again, your any diagnoses you have, special services you require, what kind of medications you take, and what schedule you're taking them on. They're going to want to know about if you have a caregiver, how much that caregiver is available, how much that caregiver is willing, how much that caregiver is able to help you with the things you need help with. They're going to ask you about other social resources. Do you have a spouse or a other family member or a friend or church community that assists you? And then environmental risks. So, where are you living? What risks may be associated with the fact that maybe you're living on a third floor apartment and you don't walk steadily, or environmental risks about, just the kind of the neighborhood you're living in, what kind of housing you have, is it appropriate? Is it causing a risk for you to fall or to hurt yourself or to not be able to receive care? So that's essentially the screening process. I mean, it feels quick and relatively simple, but that screening process is what gets you through the door for the long-term care waiver. So once you've completed your screening process, now you're either going to go onto the waiver or you're going to go onto the wait list. So for those who are not immediately placed onto the waiver or denied services, you're going to go onto the wait list. So let's talk about what that looks like. So I mentioned earlier the kind of ranking the priority score that they give you through the screening. So all your answers to those questions about your medications, your activities of daily living, are going to help them decide, kind of what level of need you have. So the rankings go from 1 to 8, and the ranks 1 and 2 are considered low priority. So this is kind of a reverse list. Being number 1 is not good. You are low priority if you are number 1. The higher priority scores are ranks 3 through 8. If you are placed in rank 1 or 2, you do not go onto the wait list. If you're 3 or above, you do go onto the wait list, and the higher your rank, the higher you are on that wait list. And I do want to mention that the long-term care waiver wait list isn't a wait list in the way that people typically think about it. Like it's, you know, first come, first served, or, when one person comes off the wait list, you move up a spot. It doesn't work that way. It's not based on when you called or when you applied. It's based on your priority score, which can change at any time. That priority score can change. It's not based on when you first called or when you applied again. It's based on your need. So if you lose a caregiver, if you lose your housing, if you have an injury and now have much more physical impairments or needs for care, that's going to change your priority rank. And we'll talk about getting rescreened later if something like that happens. And then there are some individuals who, based on certain circumstances, are able to bypass that wait list and are just going to go directly onto the long-term care waiver. So those individuals who can bypass the wait list are listed here. They are individuals who are 18, 19, or 20, who have a chronic debilitating disease or condition that makes them dependent on 24/7 medical, nursing, or health supervision or intervention. So these are our very medically complex young people. The second category of people who can bypass the wait list are nursing facility residents. So someone who's clearly meeting the level of care because they're already in a nursing facility who would like to transition back into the community. But for those individuals to bypass the wait list, they have to have been in that nursing facility. It has to be a Florida licensed nursing facility, and they have to have been there for at least 60 consecutive days, meaning you haven't left for a hospitalization or anything like that. The third category is individuals who've been referred by the Department of Children and Families, Adult Protective Services that have been identified as high risk and who DCF has placed into an assisted living facility due to abuse or neglect or exploitation. And the final category is adults with cystic fibrosis. So there's no specific age as long as you're 18 or older. If you have cystic fibrosis, you're eligible to bypass the wait list. So once you're on the wait list, say, like I was saying earlier, things may change. And if they do change, you want to let the ADRC know. You want to let the Department of Elder Affairs know so that you can be rescreened to hopefully move you closer to the top of that priority list. And by the top, I mean move you up to closer to rank 8. So depending on what priority score you received initially, you may or may not be automatically rescreened. So if you were in categories 1 or 2, rank 1 or 2, from your initial screening, you might be rescreened annually, but the ADRC doesn't necessarily have to rescreen you annually. But if you're in rank 1 or 2, you will be rescreened if you tell them that you've had a significant change in your circumstances. And we are going to talk about what that means exactly, what is considered a significant change. But if you were initially placed in the higher priority scores, the ranks 3 through 8, they will automatically screen you every year. So you can expect to hear from them. They'll send you a letter, go ahead and respond to it and get your rescreening each year. But also, again, you can notify them and tell them you've had a significant change in your circumstances, and they will rescreen you at that point as well. So, what is a significant change in circumstances? So this is defined in our statutes. And what they're looking for as far as a significant change is one of the following. It does not have to be all, it can be a combination or just one of the following. So it could be a change in your health status after an accident or an illness. So maybe a fall that caused a significant injury and you've lost some mobility, or an illness that's now requiring you to have a lot more medical interventions. It could be an actual or an upcoming change in your living situation. So if you know that in 3 months, I'm no longer going to be able to live in my daughter's house. She's moving to China. I don't know. So I'm not going to have this support that I've had before. And we know that's for sure. So it can be a change that's already happened or something that you know for sure is about to happen. Another thing, the third option for what could constitute a significant change is a change in your caregiver relationship. Say your spouse was your caregiver and now you are divorcing. So you will no longer have your spouse. That is considered a significant change in circumstances. Your fourth option is loss or damage to your home or deterioration of your home environment. So, this could be hurricane related or flood related. You've literally lost your home, or the deterioration of the home environment might look like things like, maybe your children divorced, and now all of a sudden you have 6 more people living in your house than you had before. And so your caregiver is busy doing other things and is no longer able to provide you care. It all sorts of things could constitute a deterioration of your home environment, but it's essentially any change in that home environment that makes it harder for you to rely on your current caregiver or your social supports to receive care. And then the final option for what could constitute a significant change in circumstances would be the loss of your spouse or caregiver. So that's loss by death, divorce, or any other reason. Maybe they just chose to no longer provide care or whatever. So if you had a spouse or caregiver who was assisting you and you've lost that person for whatever reason, that can constitute a significant change, and you should be requesting rescreening if any of these things are true. So, and again, on rescreening, essentially you're just trying to move up your priority rank to get closer to 8 or to go straight onto the waiver. So assuming, you've had your change in circumstances or you're on your initial screening, you're going to go on to the waiver. So what's going to happen? So once you're past the wait list or approved because you're in one of those special categories that gets to bypass the wait list, you are enrolled onto the waiver. First, you're going to receive a notice from the Department of Elder Affairs that's going to say, we're ready to enroll you on the waiver. It's going to ask you to fill out a form, and you need to fill out that form immediately and send it back to them. You're supposed to do that within 30 days of the date of the notice, but I would suggest doing it as soon as possible. Then at that point, it's the Agency for Healthcare Administration who actually enrolls you onto the waiver. That waiver is administered by the managed care entities that are overseen by the Agency for Healthcare Administration. DOE, Department of Elder Affairs does their bit. They have you fill out the form, say, yes, I still want this, I still want to be on the waiver. They send that to Agency for Healthcare Administration, who actually places you onto the waiver. When that happens, the Agency for Healthcare Administration is going to assign you to a managed care plan. So we have different companies that offer these managed care plans in our state. We have, for example, Sunshine or United Healthcare or Aetna. So different managed care entities, and some of them offer these long-term care waiver services. So Agency for Healthcare administration is going to automatically enroll you into one of those plans. They'll notify you, they'll send you something in writing saying, here's the plan you've been put on. But that notice should also include information about how to switch plans if you want a different one. Some of the plans offer more than others. You might have a certain doctor that you really like who only accepts one of the plans. So, your reason for choosing one plan or another is likely to be personal to you. But you do have a choice. And if you want to switch the plan, if you don't like the one that they automatically enrolled you in, you can do that. The notice where they say, here's the plan we put you in, will have a deadline on there saying, if you don't like this plan and you want to switch, do it by this date. Generally, it's 120 days after you are first enrolled onto the waiver, where you could make changes to which plan you want to be in. After that 120 days, every year there's an open enrollment period, and you can switch plans freely during that open enrollment period each year, or you can switch plans if you can prove good cause. And our regulations do define what good cause might be. An example of good cause would be, for instance, I need a specialized service and my plan doesn't cover it. And it's medically necessary. My doctor has prescribed it, but my plan will not cover it. But there's another plan available in my area who will cover it. So if you are completely unable to access the service because of the plan you're on, that is good cause to switch plans at any time during the year. So, and then once you're on your plan and you're enrolled, you should start, you are assigned a case manager, and you should start, receiving your services covered through that plan. And work with your case manager to set up anything that's not, coming through quickly or that seems to have been missed. But your case manager that you receive as a long-term care waiver enrollee is really your kind of lifeline to each of the services and medications and all the things you need. So what happens if you don't like the decision that was made? And we might be talking about the decision as far as which priority score you were placed in, or the decision to completely deny you services at all. So if you don't like the decision that was made, if you disagree with those screening results, or if they're saying you don't require a nursing level of care and you disagree with that, you can request a fair hearing. And any notice you receive that where an agency has made a decision should contain that information, excuse me, on how to request a fair hearing. And a fair hearing is basically, it's like a little mini trial, and they're generally done over the phone, but you'll be able to go in and plead your case to a hearing officer to explain, here's the information they missed, here's why their decision is wrong, and ask that hearing officer to revisit that decision. And I'm not going to go super in depth here onto how to do a fair hearing, or how to deal with a fair hearing, because we have a whole webinar about preparing and presenting your fair hearing specific to Medicaid that we've recorded previously, and that is on our website. So here on this slide, I've put the link to that webinar that we previously did. And if you are looking at requesting a fair hearing, I definitely check that out. That's also something that DRF may or may not be able to assist with. You may be interested in calling our intake line to see if one of our attorneys or advocates can help you with your fair hearing. Unfortunately, there's quite a large demand for that, and we can't always say yes to everyone, but we do offer that type of assistance. So, but again, we have the webinar as well, and these are meant to be the types of things that you can do. You're supposed to be able to do these without an attorney. So please, utilize that resource for that. So that's really all I have here for the long-term care waiver, eligibility and screening process and the wait list. The problems you might encounter if you're on the long-term care waiver, not getting the right services, not being able to provide, find providers, those sorts of issues that may come up are broad ranging and also usually highly individual. So, again, if you're on the waiver, or if you've been recently enrolled and you're having difficulties with your case manager or finding the right service or finding the right provider, again, feel free to contact Disability Rights Florida for some information or assistance on that. But yeah, that's the basics of how to get into the waiver and how to get screened and what will happen once you do. And and we have plenty of time for questions if folks have any.
Okay, thank you, Caitlin. Before we begin taking questions, I just want to bring everyone's attention to the QR code on the next slide. It will take you to a short survey asking for your opinion on the content provided today in this presentation. We would greatly appreciate it if you could take a few minutes to give us feedback so that we can continue to provide or improve the programs that we offer. There is also a link to the survey in the chat if you prefer not to use a QR code. You can scan the QR code or click the link now and wait until after the question and answer session to complete it if you like. So we have a lot of time for questions. As a reminder, if you have a question, please post it in the Q&A using the Q&A button at the bottom of your screen. And please try to limit any personal health information about yourself so that we can maintain your privacy. So I am going to ask the first question that came into the Q&A. First of all, our first question is the program only for those who are 18 years and older?
Yes, it is. It is only for those who are 18 years and older, and that's because children have access to more robust Medicaid services through straight Medicaid. The way the federal government has designed the program, children have more robust benefits, more robust options, and they're able to receive all the private duty nursing and those sorts of things through just simple Medicaid without having to go onto a waiver. So yeah, there's no long-term care waiver for children.
And I think you just answered this question as well. Is the waiver available to minors with rare diseases?
Yeah, no. So again, that's either going to be, if you qualify for the APD, the I-budget waiver for developmental disabilities, that's one option. Children are able to enroll on that waiver. But generally, no, the long-term care waiver, or not generally, 100% no, the long-term care waiver is not for individuals under age 18. And if folks are having trouble figuring out how to get the right services for their medically complex child, again, please call us and we can help you navigate the various options.
All right. So the next question is, what is the name of the initial screening/scoring document and the rescreening document?
Oh, of course someone asked me that. So it's a long-term care waiver screening tool, and the name of it is a number, and I cannot recall the number off of the top of my head. It is available online. If you search online, you can pull up a blank copy of one of the screening tools to see exactly what kind of questions they're going to ask.
Thank you. Our next question is, can you explain the difference between this waiver and the I-budget med waiver? Can someone have both?
So no, generally you're not gonna, yeah, I don't know that there's a way to be on both waivers. So the difference is that for the I-budget waiver, you have to have one of the 7 specific conditions that they've listed for eligibility, autism, intellectual disability, Phelan-McDermid. There's a very specific list, and you have to have one of those in order to qualify for that waiver. And additionally, you have to meet certain severity requirements, not just because you have a diagnosis of, say, autism doesn't necessarily mean you will reach the threshold of being able to be eligible for the developmental disabilities waiver. The long-term care waiver is not attached to specific diagnoses. So regardless of the reason why you require, this medical care, you should be able to qualify as long as you meet those age requirements and the level of care requirements as far as needing a nursing level of care or hospital level of care. And then again, always with the Medicaid eligibility, income and asset limits. But yeah, you cannot be on both, but what you can do is you can be on a waiver and receive services through either the long-term care waiver or the iBudget waiver, and also receive services that are covered by your general Medicaid. So if there's anything the long-term care waiver isn't covering, Medicaid should be covering, and vice versa.
Thank you. Our next question is, can you share information regarding self-directed waiver services?
Sure. So in the long-term care waiver world, there is it's called PDO, the person directed option. So it's similar, but not exactly the same as the CDC Plus option under the iBudget waiver. The CDC Plus option is a little broader, and you can do a little bit more with it. The PDO option under the long-term care waiver does allow you to kind of select your own caregivers, and pay them directly, but it's more limited in what types of caregivers you can hire and for what. The CDC Plus option will allow you to basically take your money and divvy it up the way you want, and you can pay caregivers higher rates to be able to attract the kind of caregivers you want, or maintain them if they're looking at options with higher pay. You can kind of manipulate the numbers a little more under the CDC Plus option. The PDO option is a little more restricted. What kinds of caregivers that you can hire is more restricted. Their backgrounds, and training is more specific. But there is a PDO option similar to the CDC Plus option for the long-term care waiver.
Thank you. And I apologize, I just lost my question as more questions are coming in. All right, so the next question is, my son will be 18 soon. Can you please explain the services that are covered by Medicaid long-term waiver?
So the services that are covered by the long-term care waiver are vast, and they are very individualized. So what services would be covered for you or your son are going to be based on the medical necessity. So if you're, just like with any Medicaid service, the state is not going to cover it if you don't have a doctor prescribing it and saying that it's medically necessary. So, but they will cover all sorts of things, everything from your medications and your doctor's appointments to in-home caregivers, nursing, in-home nursing, um, um, personal care, home health aid. I think they even cover nutrition and meal services. If you need to have meals delivered to your home, that sort of thing. It's very wide ranging, but I will say what exactly is covered. There are some, kind of additional benefits. There's a baseline the state requires. Every plan has to cover, these baseline services. And then each plan chooses, we're going to offer a couple extras for people to try to attract them to our plan. So that's why it's really important when you have an option of choosing your plan to research each option available in your area and see what exactly it is they offer, to make sure that you're going to get the one that meets your individual needs best.
Thank you. The next question is, since an individual cannot be enrolled in both the long-term care and iBudget APD waiver, can you share how someone on the wait list for both may determine what best suits their needs? Is there a source that is well-versed in both options that can offer some guidance?
So that's pretty hard. I mean, I just individually know some people who know a lot about that, and can really tell you the difference. But as far as selecting which is the best option, not to be crass, but the best option is probably the one that you get approved for first. If you're sitting on wait lists for both and they say, okay, we're here to offer you long-term care waiver services. I certainly wouldn't decline that and sit on the waiting list for the iBudget waiver. But what you can do is, while you can't be on both waivers at the same time, you can be on one waiver and be on the wait list for the other at the same time. So if theoretically, if you're on the wait list for both and long-term care comes up and says, okay, we're ready to enroll you, take it, get what you can get. And if it's not fully meeting your needs or fully suiting you, when you do come up on the other waivers wait list, you can say, great, I'll take it. And you can move on to that waiver. Your long-term care waiver services will end and you'll be moved on to the iBudget waiver. So you can select between the two, you just can't actually be on both at the same time, if that makes sense.
Our next question is, how far in advance of a change of life, environmental change, can you request a rescreen?
That's not, I don't know if there's a specific deadline. I'm assuming this question is about that kind of anticipated change. So if you know, I think the example I used is your daughter's moving to China in 3 months. I don't know that there is a specific cutoff that if they're moving in 4 months, that's too far away, wait a month. But if you have an anticipated change in circumstances, my advice would be to call your ADRC, let them know. And if you say, hey, this is happening in 9 months, and they may say, that's a little too far out, call us back when it's 6 months away. But to get that answer, I would contact your ADRC about your individual circumstance.
All right. Next question is this based financially on my SSDI income or married jointly?
The income and asset limits are calculated in the same way, is just how they are for Medicaid. So, I believe that if you are married, it is your household assets, but it's your individual income that is counted, if that makes sense.
Great. Next question is, what services similar to this are available for someone who doesn't qualify for Medicaid? It seems like there is nothing.
That's the problem, this is kind of this is the healthcare gap that they discuss in the news. You may be slightly over the limits for Medicaid, but not have enough money to actually pay for all of this out of pocket. And when you hit that situation, you're right, there aren't a lot of options. I mean, I don't know many people who can pay, tens of thousands of dollars a year for a nurse to come in, if they're just above that poverty limit for Medicaid. So really what your option here is to do, what they call benefits planning. That's not something that DRF does. That's something that you would want to contact a lawyer about, but there are essentially ways to utilize trusts or other kind of funds to set aside assets and income, so that it isn't counted for public benefits purposes. So if you're just over that limit, you might need to look at using there's many types, special needs trusts, qualified income trusts, and look at if there's a way where you can, and all of this is legal. I know it sounds like it's, getting around the rules, but these are the rules. The rules allow for this. But yeah, you can kind of adjust the way you receive your income and the way your assets are distributed to help and make yourself eligible.
Great advice. Next question is, how do we transition to long-term care if we're currently on CMS under 21?
If you're currently on CMS and you're under 21 and you're looking at needing to transition when you turn 22, I would contact the ADRC and request screening a few months before your birthday, and let them know you're coming up on losing eligibility. That's you change in status, you know, you're going to lose your caregivers, you're going to lose everything because you're coming off CMS. So yeah, I would, heading up to that 22nd birthday, I would go ahead and contact the ADRC and get screened.
Right. Not sure if we can answer this question, but how are cuts to benefits going to affect the long-term care program specifically?
So cuts to benefits, I'm assuming, we are meaning there was some recent news that there may be some big cuts to the Medicaid program from the federal government, lots of money being cut. And you know, whether it's that cut you're talking about or another cut made by the state or some other entity to reduce funding for Medicaid, the way that would impact the long-term care waiver is not something that I can predict. You know, it's up to the state to decide. You know, the state can continue to administer its Medicaid program and waiver programs in the way that it always has, if it wants to self-fund. So even if the federal government decides to send us less money, the state can choose to, you know, allocate in our own budget to cover that, or the state may choose not to. And I don't think that I have not heard of any plans or any discussions from state officials about what exactly their plan would be if there were significant cuts to Medicaid, which it looks like might be coming our way.
Okay, thank you. Our next question is, how much time in advance should you apply for med waiver since it's for 18 plus?
So again, I would wait until you're a few months out from your birthday. You know, if you're looking at applying when you turn 18, I would, you know, once you're 17 and, you know, 8-9 months, I'd start calling the ADRC and seeing if you can get screened.
The next question is, how long typically is the wait list for services?
So that is, there isn't a typical time. And the reason is because again, it's not kind of a first come, first served list, you know. It's not like one person, you know, comes off the wait list onto the waiver, and so you move up a slot. You remain in your rank no matter what, unless you get rescreened and get moved up a rank. So if you have no changes in circumstances, you could sit on that wait list for years and years and years and years. Some people are on the wait list for, you know, a month or two, and then they have a significant change and they go right onto the waiver. It's really individual needs based. It's not a traditional waiting list in the way that you think about, you know, just first come, first served.
Do individuals approved to long-term care waiver have to disenroll from the Agency for Persons with Disabilities wait list, and why?
No, if you are approved, if you're on both wait lists and then you get approved for the long-term care waiver, you don't have to come off of the iBudget waiver wait list. You can stay right there on that wait list. There are many reasons why you might prefer the iBudget waiver over the long-term care waiver. And like I was explaining before, you can't be on both waivers at the same time, but you can be on one waiver and then the wait list for the other.
The next question is, my child is 16. Can you explain the long-term waiver for minors?
So there isn't a long-term care waiver for minors. We don't have one in Florida. We don't have anything like that. So what we have is that more robust set of services that are provided to children under Medicaid. And I don't want to go into the whole thing, but it's a program called EPSDT, Early Periodic Screening and Diagnostic and Testing. But it basically says for kids on Medicaid, they need more, and they need, you know, they need to be covered more fully. So that's why there is no waiver for kids, because the Medicaid should be covering things like private duty nursing, home health aides for children.
All right, the next question is, how do I apply for the Medicaid long-term care waiver? He's on the APD waiver wait list. Do I have to wait until he turns 18 in April? How do I start the process now?
Yeah, so if he's turning 18 in April, I would say go ahead now and contact that ADRC and see if they can screen him, before he turns 18. If it's a circumstance where he might go directly onto the waiver, you want to get that done as quickly as possible. So, I know it feels kind of weird. You normally, when you apply for Medicaid, you have to go into their application portal and put in all your info and hit apply. And this one just works a little bit differently. You actually don't even have to apply for Medicaid first. You can just call the ADRC and ask to be screened, and that's how you apply and get put on the wait list. And then, in that circumstance, if you came up onto the waiver, they would then enroll you in Medicaid, assuming you met the requirements.
All right. The next question says that they have a 91-year-old in a assisted living facility. Can she get on the waiver?
So there is that category of individuals who wish to transition back to the community if they've been in a facility and they wish to transition back into the community. So I think that if she wishes to return back to a community setting, that she should apply for the waiver, ask for those services, get screened. I will say that one of the kind of barriers to this is the housing. So they won't provide housing, under the iBudget waiver. There's all these residential settings, group homes, things like that you can go into under the waiver. The long-term care waiver doesn't really work that way. The point is to not be in a facility. So, she would need to have somewhere to go. She would need to have an apartment or a family home or whatever set up. But assuming that exists and there's a place for her to go, yeah, I'd say go ahead and get her screened and get her back into the community.
Okay, great. The next question is, can you continue on fee-for-service Medicaid while receiving services on the long-term care waiver?
That's an interesting question. So long-term care waiver services are administered through managed care. So you're not going to be on fee for service for your long-term care services. But for anything that's not covered by long-term care and would just be covered by Medicaid, if you're in one of the limited categories that's allowed to opt out of managed care, I don't see anything that would prevent you from doing that and still receiving fee for service, being on fee for service for the non-waiver services.
Right. That was our last question.
Great.
All right. So I think at this point, that concludes our webinar today. The webinar and the PowerPoint slides will be available on our website in about a week. And we just want to thank everyone for joining us and have a wonderful day.
Thank you.